May I now request Mr. Mike Soopramanien, DG Chief Impact Officer, Indo-European Digital Federation, for his talk. Thank you.
Can you hear me?
Yes. Yes, we can hear you.
Okay. Namaskar. Good morning to everyone, and thank you for Dr. Varinder Gaur to invite us. And my most sincere gratitude to my distinguished panelists with Dr. Vinod Paul, Dr. Rajiv Ahuja, Professor Abhay Karandikar, who left earlier, and Dr. Sushitra Markham. I just want to give a European perspective here. We've been very impressed by CIBIOD initiative to be an innovation and design center in the medical sector, and this is what Europe is looking for here, with India taking the leadership in terms of innovation here. And what we are looking into is for France and Europe to collaborate and build a very strong interdisciplinary platform with India. While our healthcare system is kind of collapsing or having difficulties to adapt to everything that is happening, we're looking into India as a new frontier to build, cutting-edge technology for affordable level. And this is what we can see across India now. And we've been seeing that for quite some time. And this is what we're looking into to nurture that the collaboration between France, Europe, and India in the medical sector. Because we believe that the medical sector will be the cornerstone for cross-industry development. Not only in the medical sector as MedTech, but that's a cornerstone where today with the growth of digital and AI and data, you can see that what can be prototyped and scaled in the medical field can be applied to other industry sectors. And there is an element of employment, skill development involved here. And this is what we've been looking into CIBIOD experience with telemedicine kiosks, for instance. And I'm happy to share with you that we are working with Dr. Varinder Gaur and his team to set up project pilots, either in France, Africa, or French overseas territories, to test that last mile connectivity with telemedicine. So this is a big initiative for us, because we want to aggregate our innovation pool from Europe, which is very strong, with Indian innovation level. Because today, if you can design and implement preventive and primary healthcare systems for 1.4 billion people, like Dr. Vinod Paul reminded us, then you can do it for the rest of the world. And today, to have affordable healthcare system with cutting-edge technology is going to be the game changer for healthcare system like in Europe, for instance. But not only, you're talking about the global south, Latin America, Africa, and we believe that India can be the prototyping center and R&D hub for global development. Telemedicine is the way forward, because dealing with the last mile is a big issue, even in countries like France. We have a very advanced healthcare system. Somehow, we're lacking doctors and specialists. So, and we believe that the telemedicine initiative that's been led by CIBIOD is the answer for that. And of course, this is not one model fit all, but I think it is something we can adapt to a different kind of region and territories. And what we can see beyond the telemedicine and primary healthcare is, for countries like France or Europe, when you talk about MedTech, you're talking about semiconductor development in the very near future. And this is where our countries like France and India can work together in terms of investment program to invest in those hardcore technology, whether it's deep tech and hardware technology like semiconductors, because you're talking about IoT, a lot of complex architectures and devices. So the idea is to create a new model here where Mr. Ashwani Mahajan, I think we're in agreement that what is very inspiring with India is to find that holistic model that we're all looking for. There's no high tech. This is not about high tech only. This is about low tech and mid tech and high tech together, combined together, and to find that impact driven approach. And this is what we are looking into when we are setting a partnership like we are creating and building with Dr. Varinder Garg. And I'm very impressed by the panelists' shared experience and very humble. And today my contribution is just to listen to you and see what can be done from our end with your support locally in India. And of course, invest into the Indian landscape in terms of research centers, prototyping centers, design centers, and innovation programs we can create together between France, Europe, and India, of course. And of course, for us, India is the next frontier when it comes to economic standards and economic values. And I think that I will stop here because I'm very humbled by what I've been hearing from this morning, and I'm really looking forward for the next sessions. When we talk about SDG goals, this is it. We are facing so many challenges, and I think the answer will come from countries like India, no doubt. And when you talk about digital public infrastructure we've done in India, that's a remarkable achievement. I'm really looking forward to step up that collaboration together.